Welcome back to our next episode of the Body 101 series. Today we're going to talk about a huge topic in the world of health. It's something that 4 out of 5 or 80% of people will experience at some point in their life, and that is back pain. So the first thing that I want to try to do is debunk 2 myths that I often hear here in the clinic. The first is when I have people come in and say, "Oh, I have low back pain, but that's just because I'm getting older." The reality is that age in and of itself, just getting older, is never a reason for pain of any kind, whether if it's low back, knee, shoulder, hip, etc. So there's always things that can be done for any of those kinds of conditions, including low back pain, to help you have less pain, whether if it's changing your lifestyle, whether if it's certain exercises, strengthening, stretching, or other medical interventions. There's always something that can be done. The second thing that I hear often is that people come in with MRI findings or X-ray results and they say, "Oh, I have arthritis, I have a herniated disc," whatever it may be, and therefore I have no chance of getting better, I can't do anything about it. The good news for you even is that even if you have abnormal findings on your imaging results, you can also get better and have less low back pain and better function and be able to do the things you love to do. There's a lot of studies that have been done who looked at people with abnormal findings on imaging, and they've been able to have no pain and do all the things that they love. So even when you have scary results on imaging, that doesn't mean that you're doomed. So one of the options that I want to talk about that's been in that research a lot is physical therapy. And what they've found with physical therapy, if you seek it first as your first option of care for your low back pain, is that it's one, that it's effective, and 2, that it's cost effective. So when they've looked at effectiveness of physical therapy, they've compared people who have spinal stenosis and another group they compared who had degenerative disc disease, so 2 major groups, and they compared whether they had physical therapy or if they had a surgery. And they found that after 2 years, the people in both groups were doing exactly the same. So whether they had surgery or whether they had physical therapy, they came out after 2 years having the same function, the same pain, the same quality of life. So they looked at all of those kinds of outcomes and they found that physical therapy and surgery were the same for those cases. The other thing that speaks to the effectiveness of physical therapy for low back pain is that people who sought physical therapy first for the low back pain had an 87% less chance of getting prescribed opioid medications for their pain. And in the midst of our opioid epidemic in this country, that's a huge benefit of seeking physical therapy for low back pain. The second benefit of seeking physical therapy first as an option for low back pain is the cost effectiveness. So they did a bunch of studies where they looked at the cost of physical therapy versus other options, and they found that for people who went and sought physical therapy first, the cost savings for people who would get that before they would seek imaging, like an MRI, or before they would go get an injection, or before they would go get surgery, was between 72 and 75%. So you're looking at huge savings, and as we talked about for effectiveness for treating low back pain if you seek physical therapy first. So we would love to work with you when it comes to managing your low back pain, whether if it's acute or chronic. We'd love to be a member of your team and helping getting you back to the things you love to do.